Hi, I'm Dr. Sammarco from Beacon Orthopaedics, and I'm a fellowship-trained foot and ankle surgeon. A lot of my practice revolves around the treatment of arthritis of the foot and ankle. Today we're going to talk about the difference between an ankle fusion and an ankle replacement. The real question is, why would we need either of these procedures? We talked in an earlier video about arthritis, and arthritis is a process where the ends of the joint surface starts to degenerate, and it causes a lot of pain because the bones begin to rub into each other. In the ankle, there's really two main ways that we treat this. There are some non-surgical ways that we could treat it, such as steroid injections, and there's some minor surgical procedures such as cleaning out bone spurs. But when we get to end-stage arthritis, there's really two main treatments. The first treatment is what we call an ankle fusion. Now, an ankle fusion is where we take the two bones of the ankle, the leg bone, or the tibia, and the talus, or the ankle bone, and we bind them together. We put them in a position where the patient can walk, and then we hold them together with screws. Gradually, over the course of about 2 or 3 months, these two bones will actually grow together to become one bone. When we do that, it eliminates all of the ankle pain from arthritis because the bones can't move anymore. So it's a very good operation in terms of getting rid of ankle pain. However, it is at the expense of all ankle motion. There's some real advantages to an ankle fusion. One of the advantages is it's a permanent solution. So unlike an ankle replacement, which may have parts that wear out, the ankle fusion is going to be pretty much permanent. It's a very good choice for someone who does a lot of heavy labor, who's going to be using the ankle for hard manual labor, lifting and carrying. It's also a good procedure for a patient who has a lot of deformities. So say a patient had broken their ankle and their ankle was really crooked. We can straighten the ankle quite a bit when we do a fusion. It is a little bit of an older technology, and we do have some newer technologies available. But if you have an ankle fusion suggested, it's not something to be afraid of, particularly if you have a condition which would make it so that an ankle replacement might not work. We'll move on to an ankle replacement. Now, an ankle replacement is a relatively new technology. Although it has been around since the 60s, there are many newer ones that have come out, and they continue to improve over the last 10 to 15 years, and are continuing to improve almost on a yearly basis now. Now, instead of fusing the ankle joint together, once we lose our joint surface, once we lose the cartilage, we can actually replace that with a metal and plastic bearing. So what this procedure does basically is we take some instruments and we remove the old bearing, the old ankle joint, and all of the old cartilage, and then we implant a metal cap on the talus or the ankle bone and a metal cap on the end of the tibia or the leg bone. We put a plastic bearing surface in between. When we put that together, it keeps the bones from rubbing into each other, and it still lets this ankle go through ankle motion. The main advantage of this is that you get rid of the ankle pain, but you still get to keep the ankle motion. The disadvantage is, like any moving part, this plastic bearing surface is very likely to wear out, so depending on your age, you may need to have the bearing surface changed, or it may need to be converted to another surgery in the future. Thank you.